Hi there, welcome back to the Lukin Center. My name is Timothy Meyer, psychotherapist and assistant director here at the Lukin Center. I am joined today by Dr. Brian Amorello, one of our psychotherapists here at the practice. Today we're going to be speaking about things that therapists should be knowledgeable and keep in mind when working with LGBTQ plus patients. So Brian, welcome and thank you for being here. To start off, would you be able to talk a little bit about your experience in, you're a psychologist, you work a lot with LGBTQ plus. Would you be able to speak a little bit more to the viewers about your experience?
I am a licensed psychologist in New York and New Jersey. I've been at the Lukin Center here for about 3.5 years. And I have lots of experience working with LGBTQ plus individuals, a variety of ages. I've sought out training experiences working with children, adolescents, older adults, geriatrics.
So would you be able to kick us off and start with, I don't know, maybe like in your mind, what is the most poignant thing for a therapist to keep in mind as they're working with someone who identifies as LGBTQ+?
One of the first things that I always think about when I'm working with someone from any of those communities is sort of this concept that I call meeting them where they are, right? You can't automatically assume they are like loud and proud and an advocate for their community, just like you can't always assume that they're in the closet and hate it and want it to just go away, right? So you really have to just see where a patient is, right? They may not even be there for, right? I think a lot of therapists that I've worked with in the past, right, sort of have this like automatic assumption, well, they're gay, so they must be here for some sort of gay-related issue, right? But meeting them where they are kind of informs you of how much of the presenting issue is impacted by that area of their identity. So that's usually the first kind of 101 step you should really follow.
Yeah, and I'm almost thinking like, perhaps a therapist might fall into the trap of like, oh, they identify as bisexual. I know what that is.
Right.
And well, yes, you do know what that is, but you don't know what that is like for that individual person, right?
Exactly.
So hugely important to meet them where they're at, to see what that is like for them.
Right.
Because it can be 100% different from individual
Right.
one to individual number
Right.
two.
Right.
So totally agree with you there. Makes all the sense in the world. Speaking of intersectionality and when it comes up in the therapy room and how you're working to address difficulties, feelings, when intersectionality sort of collides, talk to me a little bit about how you approach it.
Again, right, you want to look at all of the areas of the person. One of the first things I'll ask a person that I'm working with is, what is your race and ethnic background? What is your religion? Right? What is your gender? Right? We have to ask all of these questions nowadays because it gives us a whole lot of information about the person, right? And with that being said, we know that those areas of identity intersect in some way. And sometimes they intersect and everything's fine. And sometimes they intersect and it creates a lot of internal conflict for a person, right? Trying to juggle a very Christian faith with their sexual orientation can be very challenging, right? But so what you want to do is, you can always ask the person basically, tell me a little bit about, what it means to be a Christian gay man, right? And see what they say. And they may say fine, and they may say, you know what, that's pretty much why I'm here, and I need to figure out how to balance and juggle all of these different parts of me.
Sure. One thing you mentioned before, and you just made me think about it again, it's extremely important not to jump to the conclusion that someone is coming to you for an issue related to their gender identity or their sexuality or anything like that. Could you give me an example of perhaps maybe something that you've heard of, not you, but something that you've heard of maybe like a therapist falling into that trap?
Well, I don't know if this is an example, but it's an experience that I had. So I during one of my training years, I was a part of a team, obviously, and we would have weekly meetings of basically, who would get the patient, right? So they do the intake. That's not necessarily the person that they're going to be working with on an ongoing basis. So the person would say, 25, gay, male, coming in for, work-related issues and trying to figure out what he wants to do in terms of his career. Oh, we'll give him to Brian, right? Because I identify as gay myself, and we can talk more about that later on how that impacts my work. But it was just sort of like this, well, why do I have to, like, not, of course I welcome working with the patient, but it was sort of like this interesting kind of nuancy thing that I just thought was interesting. And, you know, it kind of implied to me that this particular therapist thought that that might be a bigger issue, so they have to give it to the gay cisgendered male because I would be the one to best work with them.
So think about, you know, I know that in settings when things are set up that way, where cases are assigned by a higher up clinician,
Right.
So
Yeah.
so that's just it's interesting to think about, right? Like a person in the position of power who is senior is automatically making the inference
Right.
that this individual who is just a piece of paper would be best fit by you
Yes.
because of their
Yeah.
their sexual orientation
Yeah.
and your sexual orientation.
Right. Right.
And it's almost like the presenting problem, like it might as well have been blacked out.
Right.
Like
Exactly.
coming in for work-related issues, you said.
Right. Right.
It could have, the presenting problem could have been anything else.
Could have been anything.
But
right.
it's like, oh, Brian, perfect.
Right. Right.
But that's not perfect.
Right.
Because we're literally looking at one word in an
Right.
entire intake.
Right. Exactly.
And,
Well, you know, and I think it has a lot to do with, like, I don't know if stigma is the right word, but like the therapists, people in general, we automatically, I think, go to, oh, this person must have experienced some level of mental health issue because they are part of this marginalized community. And it's not always the case. You know, it's not always the case. You know, many of us, thankfully, are fortunate to have a very good coming out process, a very good, you know, move along through the stages of gay identity development that we may or may not talk about later, right? So all of this is really important to figure out. But it kind of leads to my second point, if I may.
Sure.
So I think that the second really most important thing for a therapist to do is check your bias. And I don't necessarily mean negative bias. I also mean positive bias, I guess, if that's the word. And what I mean by that is my experience as a gay man and as a psychologist has not always made it so easy for me to work with someone who identified the same way as me in terms of their sexual orientation. And I think it's because I have such this, like, you know, in my personal life, right, I'm an advocate, obviously, for the community. You know, I believe in coming out. I believe that once you come out, a lot of mental health improves through that process. Once it's done and the challenges are faced and you work with someone to be able to work through them. But I also have to remember that not everybody has the same process as me. So what I mean by that is working with someone who may have an evangelical Christian family, right, who is really struggling out with the, right, when I was early in my training, I was like, just come out, you'll be okay, right? But that,
because you did.
for the most part, that was my experience, right? And I'm grateful for my parents for giving me that experience. But my supervisor said to me, she's like, you got to check yourself here, right? You have to make sure you're understanding that you are not them, right? And obviously that goes with all patients that we work with. But I think it was just me just wanting to kind of like just make them okay as quickly as possible, right? And you have to watch that. And on the flip side, right, you also, if you're someone who does not adhere to LGBTQ plus rights, does not believe in, you know, anything in terms of their advancements, probably not the best person for you to work with.
Right. So really being super mindful and aware
Yes.
of sort of like, I guess the best way to put it is like both positive and negative biases. Right. Like, you know, you being gay makes me feel maybe like I want to empower you.
Right.
And then that gives me an excited feeling inside.
Right.
Now, that,
Right.
yeah, that might feel good, but we still have to check that too.
Right.
Because then all of a sudden I'm becoming a cheerleader and I'm
Yeah.
sort of in one way or another encouraging you to come out, but maybe that's not your goal.
Right.
And the other side of that coin too, maybe like a negative bias, right? If if a certain therapist doesn't have such a positive personal view of LGBTQ plus individuals, you know, perhaps they might well, I think that bias doesn't really need to be explained.
Right.
But I think that's a super important point. Now, you mentioned something before about stages,
Yes.
skills.
Yes.
Could you share more?
So brings me kind of to my third point, right? It's really important for a therapist to sort of assess if if there's gay-related issues within the presenting problem, right, because there may not be, as we said earlier, but if there is, right, to be able to assess the area or the stage of, I like to use the stage of identity, gay identity development that they're in. Now this is just specific to gay men. There are other scales and other models for gay men, and obviously there are other scales and models for, you know, the other acronyms in the other letters within the acronym. So for example, Vivian Cass, right? She's one of the founders of the gay identity development. She coined these 6 stages, where the first one is confusion, where the person is sort of like, I'm confused. You know, I'm supposed to like women, but I think I have sexual attraction to men, right? The second one is comparison, where it's a little bit more prevalent and it's a little bit more in your awareness, and you're starting to compare yourself to heterosexual people. The third one is tolerance, identity tolerance it's called, where you're like, okay, I can tolerate this a little bit, you know, I'm coming into myself. Now again, there's way more that you can read on within each of these stages. The next one is acceptance, right, where you're starting to accept it and you're okay with it. The next one is pride, right, so this is like, I am a gay person before I am anything else. I am proud, I am prideful, and I am just all about being gay right now, and I've worked so hard to get here, and I'm going to make this all about my identity. And then the last stage, which I really, really like and appreciate, is what we call synthesis, right? So what we're able to do in the synthesis stage is really kind of nicely integrate different parts of ourselves. And yes, we're gay, I'm a cisgendered male, I'm a psychologist, I'm Caucasian, I'm a son, I'm a video game player, I'm all of those things at the same time. Yeah. And it's a really nice way of just kind of feeling like, I've gone through all the stages and I feel really good. So the therapist, and there are scales that the therapist can use that sort of yields a score that will put the person in one of these stages, like things like that.
Gotcha. Talk to me about why it's so important to be able to sort of understand where any given client is at on that scale, on those trajectories.
Well, because I think it tells you a lot about how they feel about that area of themselves. Now, let me, like, the goal may not be synthesis, right? You could be really mentally healthy and in the tolerance stage, right? Tolerating something isn't a terrible thing, right? So, but it just gives you an idea about where they're at and how they're sort of using that part of their identity and how that informs perhaps, you know, any struggles that they may have. But again, right, you can be in a stage, you could be in the like some people are confused and I'm like, okay, I'm fine with that, right? And they're not necessarily, that doesn't impact their mental health or doesn't cause depression or doesn't cause anxiety in any kind of way.
Right. So another way of saying that, I think, is, you know, we don't want to over pathologize, like,
you don't want to, right.
Or, well, you don't really want to pathologize any part of the scale.
It doesn't yield a diagnosis, it yields a gay identity stage, and it tells you a little bit about how that area of identity plays a role in their lives. Yeah. That's it. Nothing more, nothing less.
Got it.
You know.
Got it. And, well, my last thought about that is, what a great tool to be able to continue to work towards meeting people where they're at.
Exactly, right? Because that gives, you know, some psychologists and therapists that I know love scales, right? And they love the, you know, objective number. You know, I always say life is not a number, right? But numbers are helpful, you know, so it gives them a little bit of an idea objectively about where the person is in terms of that very fluid process that happens over time.
Brian, next question I have for you. What is your experience of, you know, a patient coming into therapy who does identify as LGBTQ+? Do you feel like there's any sort of like differences on the therapist and their identity if the therapist identifies as LGBTQ+? Do you think that there's any sort of like strengths or benefits to that? Or, well, I want to hear your thoughts.
Well, again, like I mentioned earlier, right? Like I think it could be more challenging, right? It could be more challenging for the therapist to work with someone who's exactly the same as you. I think that, you know, working with someone who's different than you can sometimes be a lot easier than working with someone who's the same as you. Because I think you bring a lot of yourself into that work that can sometimes really be a struggle because the patient's experience is very different than yours. As for therapist preference, I would assume that, or I would think that, again, to go back to the presenting problem, if the presenting problem is heavily related to LGBTQ plus issues, then I would assume that they would prefer someone who can at least identify or get their experience. That is not to say that a cisgendered, heterosexual male cannot be very, very helpful and make a huge impact on their lives, right? We're talking about patient preference here. So yeah, but if a guy is coming in and he happens to be gay, but he's coming in for those work-related issues, then I think he's going to care much less about the sexual orientation or the gender of his therapist.
Sure. Brian, my next question for you. What, as a therapist watching this video, as therapist, what assumptions do you think that it might be easy for a therapist to make that you would want therapists to be mindful and aware of, that they might be assuming perhaps a little bit off?
I think I like to call this sameness versus uniqueness, right? I think a general assumption that therapists and people have is that everybody within the LGBTQ plus community wants to be the same as our heterosexual cisgendered society in terms of rights and advocacy and all of that stuff. That's not always the case, you know, and what I've found in my research in the past is quite the opposite, right? That sometimes, you know, people can reach that synthesis stage, right, where they're kind of comfortable who they are, they've integrated all of the areas of their identity, they intersect well, but they don't necessarily feel like they need to be the same as a society that, quite frankly, has oppressed them and marginalized them for quite some time. Right? So I think it's wrong to assume that a gay person that you're in front of, or, you know, someone who isn't on the, you know, normative spectrum of the gender scale, wants all of those things. You know, I mean, individuality and uniqueness is a great thing.
Right.
You know.
Right. And I think that's very important. And I think a lot of people, you know, like, come from a good place where they're
comes from a great place.
They're able to see that, like, they come from a place of privilege, and they're speaking with someone who has been historically oppressed, and they say, "Oh my gosh, that is terrible and awful," and it's, "Oh, like, you know, you really should have, like, the exact same rights and the exact same everything as me."
Everything, right?
And it comes from a great place, but that's an assumption, and I think that actually needs to be asked about and explored, because that very well may not be the case whatsoever.
My graduate dissertation found that men who are in that those 5 and 6, that pride and that synthesis stage of gay identity development that I was talking about earlier, were less likely to want kids in their future. And the ones in the initial stage, right, the confusion and the comparison, right, sort of those negative terms, were more likely to want kids in the future. And the reason why I hypothesized that was because having a child sort of, you know, gives off that I'm sort of heterosexual kind of perspective, right? Whereas the people who were super okay with themselves, right, were less likely to want kids, right? Super, you know, synthesized, were less likely to want kids, right? So it was completely, my hypothesis was not accepted, by the way, because I thought the opposite would be true.
Interesting.
You know, but yeah, it was really interesting, and I mean, one would assume, right, if you see a man holding a baby or, you know, playing with his son at the park, right, odds are the person's going to think, well, that's probably a straight man, right? So having that sort of as a mask really kind of confirms that they're in those earlier stages of identity development.
Interesting. Those are very interesting findings of sort of like where folks fall along those scales, and their would you call it like uniqueness versus
Well, I mean, one would assume that prideful and synthesized gay men would want kids, right? would want equal rights, would want the right to adopt, and would want, but it's not what I found. And it was a dissertation advisor that I had, someone who was on my dissertation committee, and he's like, you have to check yourself. And he said, you have to understand, and he was so well versed. His name was Dr. King Mott. He works out of Seton Hall University. And he told me, you have to check yourself because sameness is not what everybody wants. And it was him that sort of was like, you know what, that makes complete sense.
Yeah.
Right?
I think all therapists need to keep that in mind, sameness. Yeah. Interesting.
And again, what was my first point? Meeting them where they are. Not assuming they want to come out, not assuming that they're mentally unhealthy because they're in one of those earlier stages of gay identity development, just meeting them where they are. Awesome. And that's what I...
Brian, I feel like we could talk about this.
We could talk about this forever.
All day. Yes. For the viewers, what's one more key take-home point that could just be a nugget of information that sticks in my mind and every other therapist's mind when they're working with someone who is in the LGBTQ plus community?
I think early on in a therapist training, we operate under the assumption that we should know everything, right? But there's a vulnerability in not knowing. There's a vulnerability in saying to someone, I'm not sure what that term means, help me understand, right? And a patient is not supposed to teach you anything, right? But I find that it creates a really good connection when you do show that vulnerability in the room and they're like, wow, he's not just trying to give me some textbook version that he learned in grad school, because that's not life and that's not realistic. Yeah. So it's all about just taking a step back sometimes and not always needing to know everything and not always assuming that you know what a person wants.
And I think especially important with this population, for aforementioned reasons. Yeah. This is fantastic, Brian. I want to say thank you so much. All this was extremely helpful. Thank you so much for tuning in to the Lukin Center. I hope you enjoyed our video, and we will see you next time. Hey guys, if you like what you just saw, please feel free to check out our videos in our library and also hit the subscribe button so you can check out our future videos.